Hi there, and welcome to the ATS podcast with me, Will Brown, and John Soulsby, where we break down chunks of health and fitness information into bite sized pieces, remove a bunch of the noise, and just leave what's relevant. Today, on Season 2, Episode 48, we have Optimizing Recovery, cutting edge techniques for faster healing. Um,
Stem
Realistically,
cells.
yep, stem cells, that would be great. Those are real cutting edge technology for fast
Yeah.
healing. Can't wait for my protein to start doing doing a stem cell whey protein in fucking pancake flavor or wherever they do.
Oh, here we are. Let's see. Off to Google. Does someone do?
Does someone do stem cell protein? I think you'll find collagen before you find that. How much does stem cell treatment even cost?
I mean, there's a stem cell activator on eBay.
Oh, an activator. What the hell? An active? What does that look like?
Don't know. It's on eBay. I'm not even going to give it that. Absolute Integrative Physical Medicine. Here we go. Types of stem cells. Nice. 3 supplements to naturally increase, to boost stem cell production.
Mm.
Oh, this one's an antioxidant too, because they're bad. Get those free radicals out of me.
Cost of a private stem cell treatment consultation without health insurance typically costs £200 to £300 at a private UK hospital.
Yeah. Oh, UK. Okay.
Tell you
I was
what.
like, that's very reasonable. I was like, oh, UK one. Okay.
Yeah, also UK. Also, it just says the consultation,
Oh yeah.
not treatment. It says treatment consultation, but I imagine that means they talk to you about it. You're essentially paying for an appointment. Prices vary largely on geographic. You can expect an average cost between £2,000 and £4,000 per knee.
Nice.
I like how they assumed knee. Stem cell research reveals UK stem cell clinics using misleading information. Interesting. Misleading
Oh
marketing techniques.
yeah. There's oh, this one supports the powerhouse of the cell.
Oh, mitochondria.
Yeah.
A majority of
Prevent
UK
the
stem
death of
cell
cells.
treatment clinics are using ethically doubtful marketing techniques, including the use of celebrity and footballer endorsements. I'm glad they separated the two. Uh,
Yeah.
New research from Abertay University in Dundee has found fucking Dundee doing the Lord's work as usual. Study published in the Journal of Regenerative Medicine carried out an analysis of websites belonging to clinics offering stem cell treatments in the UK, finding almost 80% to be potentially problematic.
Yeah. I love this. It's a safe alternative to painkillers because it treats arthritis and joint pain.
You know what else
But,
helps
but it
arthritic
doesn't.
symptoms? Lifting weights.
Left and ways. Fuck dweebs.
It's not, I was about to say, it's not even a lie, fucking nerds. A
Um,
scoring and rating scale was created to assess the likelihood of prospective patients without medical or scientific knowledge receiving misleading information. This considered, does the website fail to make public or trivialize risks or side effects? Are treatment effectiveness claims made incorrectly or without evidence (brackets peer-reviewed clinical trials)? Is curative potential claimed incorrectly? Is exaggerated language used? Oh dear.
yeah. This one's apparently can prevent the death of cells. You don't want that.
Yeah, you definitely don't want that.
For anyone who doesn't know, I think it's like every 7 years your body will have an entirely new set of cells for everything.
Yeah. I also think when
A
you start
very
messing around
natural thing.
with cell reproduction is how you end up with cancers in an extremely basic idea.
Yes.
Like when you start doing things that make it grow at an unreasonable amount of time and the likelihood of, like manufacturing errors go up, that's when things can go wrong, in my completely
Yeah.
idiotic
Or not
opinion.
grow.
Or not grow, yeah,
Like
that
if they
is.
don't die, and then your body's like, "What the fuck is this?"
Yeah, you just accidentally give yourself gigantism.
Yeah.
UK
God, they
clinics
take
with
an hour for lunch every day. These people.
Yeah. With prices offered for those providing ranges from 995 to over 7,000 for stem cell injections for cosmetic use, alopecia, and joint issues.
Oh,
The
here we
guy at the
go.
top of this article is bald, so they clearly don't work.
Yeah. We've got Alibaba now with some fucking stem cell powder.
Oh, stem cell powder from Alibaba. That is like. That is like. Oh, that is such a new level. That's like the fucking. It's like when people talk about folk who buy, what was it? There was
Apple
that.
stem cell extract.
Oh, you want those apple stem cells? That's how you really keep the
What is
doctor
this?
away.
It's fucking $60.
Oh, so you mean Apple like the company, like Steve Jobs?
No, I don't.
Oh.
I'm gonna say no. Oh, this one's oranges.
What was this new fat loss thing that came out that everyone was going mental about?
Right, this one definitely works. Stem cell powder, stem cell enhancer, 60 cents. That'll definitely do the
I
job.
feel like Dr. Nadolsky was talking about it. I need to fucking see what it is.
Oh, and here we are, some peptides. They're here already.
Ozempic, that's the one.
Okay, anyway, not stem cells.
But yeah, it's folk who are on about. Oh, it's actually on Diabetes UK. Excellent. It's a type 2 diabetes medication which is prescribed to manage blood glucose levels. It is not a medication for people who do not have diabetes or are pre-type 2. Brand name for semaglutide is a GLP-1 analog. Alright, Google, I am an idiot. What is...
But yeah, I think other techniques for faster healing
Oh, yes.
for this. I suppose the people keep trying to reinvent the wheel on this topic, but realistically, sleeping loads and eating lots is where you're at.
Yeah, sleep specifically. Plenty of people eat loads, albeit
Well,
sometimes
very
too
true.
much.
Very true. Eating lots of protons and vegetables.
Yep. Fruits and veggies. Protein.
Yeah. After that, I suppose one of the more cutting edge ones are those like little legging things that you sit in for half an hour, but whether they actually work or not, I don't really know.
Nah. Again, it's
Yeah.
one of those where you're like, they'll feel nice, but like whether they actually make an increase in recovery time is very different. Like the kind of
Yeah.
separation between feel good, which again is fine in itself, and has actively reduced your time to baseline performance and therefore improved recovery, very different.
And I think some of the issues as well is for 99% of people, you can make very big differences by just improving diet and sleep.
Yep.
And unless you've done that, there's no point looking for something cutting edge.
I'm just looking at Ozempic, just because again I was curious. But the side effects, like everything has side effects, Ozempic's no different. Common side effects can include constipation, diarrhea, classic. Whilst less common side effects include altered taste and acute pancreatitis. I'm like,
Sounds great, mate.
sounds great. I'm definitely just I'm gonna take this fucking type 2 diabetes medication to help with my weight loss, because I'm just a bit overweight. Bruh.
Diarrhea helps with weight loss.
It does.
Confirmed.
What's that? There was a drug, a weight loss drug kicking about, which essentially would just bind, like, it would just clog up all your fat, so you would just shit it out all the time. I can't remember what that one was, but everyone was just concerned because they were pooping big, like, yellow fatty masses.
Mm-hmm.
What was it called? Prescribed for Orlistat. There we go. Just looking because that Orlistat is a weight loss medicine that can cause yellow stools by having sterohoia. Oh, that is a medicine word I can't pronounce. A high fat in stools, but yeah, it's quite funny just because it's called the Pootorial.
Oh.
Very good, good puns. But yes, as if the horrendous distraction of stupid internet searches hasn't made it very obvious. Like, you can't really reinvent the wheel for recovery. Legally, plenty sleep, decent management of stress, i.e., if you are in a situation like if your life has a setup, like if your current like work-life balance includes keeping the bills paid and keeping your relationships completely normal and doesn't have a high stress working environment, do your best to minimize any stress that you just happen to conjure up in your own brain worrying about stuff that doesn't matter. Um, and you will probably have a much better time with your training alongside sleeping plenty and eating a well balanced, healthy diet.
Yeah.
Illegally, steroids help recovery tremendously.
Yes.
I mean, if you have them for personal use, they're not illegal, but you know, if you have enough with that they can prove intent to sell, probably in trouble. However, yeah, they work great. What else? Creatine, that's legal. Definitely get that, but obviously it's a gateway drug as soon as you take it. But
Obviously,
yeah, a couple
you're
months
on the
later
gear.
you'll be on the gear. It's a short, slippery slope from creatine to trenbolone. Yeah. Again, it's just don't reinvent the wheel. Sleep is way better than pretty much everything, and you'll be fine.
I
Also, don't
suppose in
buy.
that bracket,
Uh-huh.
the one thing that can then help you sleep is melatonin as a supplement.
That's true.
That
Yeah,
one
it can help
we've
you
never
sleep.
really mentioned that before.
Yeah, it
It's
gives
one you
you
could.
a decent chance at having a better night's sleep or
Yeah.
going to sleep easier.
Yeah, if that's something you struggle with, it is.
Mm,
Or again, I suppose touching on people who have shift work, it can be really good if you're on like some on night shift or something and try to get sleep through the day.
definitely. But yeah, sleep is the big one.
Yeah, definitely.
Right. Catch you in the next one, folks.
Yeah.